Okay, my name is Courtney, and today for my skill, I'm going to be inserting a nasogastric tubing into my patient. So first off, I have the bed at working level. I have my patient in an upright position. I've explained to him what I'm going to be doing. I have a chucks over the top of his chest, an emesis basin, and a box of Kleenex, just in case my patient should have an emesis during the insertion of the nasal tubing. Then I'm going to go ahead and assess my patient's nostrils to see which nostril is going to be the best to use. Making sure they don't have any polyps on one side, surgery on one side or the other, deviated septums, anything like that. So I'm going to be using the left hand or the left side nostril for today. So I'm going to go ahead and I'm going to grab my nasogastric tubing here. I've already put on my anti-reflux valve to make sure that nothing comes out of there while I'm inserting it. And I'm going to measure to see how far down this tubing is going to need to go to get into the stomach. So I measure from the tip of the nose to the tip of the earlobe, from the earlobe down to the xiphoid process. That's going to be approximately how much tubing I need to get into the stomach. It's just an estimate, so I will do some checks before when I have the tubing in. I'm going to mark that with a piece of tape so I know how far to go down. All right. Then I'm going to coil the tip of the tubing just a little bit so that it has just a little bit of curvature in it so that it flows naturally with the curvature of the nasal passage. Then I'm going to go ahead and put lubrication on the first 3 to 4 inches of the tube. I'm only going to go down the first 3 to 4 inches and then give my patient a break. Or 3 to 4 inches or until he starts gagging. So I'm going to go up the left nostril, telling my patient to look straight ahead. I'm going to go up the left nostril here, about 3 to 4 inches, or until my patient starts gagging. Then I'm holding onto the tubing. I'm going to go ahead and give my patient a break, give him a drink. I would have my assistant do this for me. As she's doing that, I'm going to tell him to continue to swallow as I hand over hand insert that nasal tubing into my patient as he's continuing to swallow until I reach that point where I have the tape. Holding on to that tubing, I'm going to go ahead, I'm going to grab the piece of tape that I have divided into two, the tear down the middle into two different little pieces here. That's going to go over the bridge of the nose. Just to hold it, I'm going to wrap one, as I'm holding onto the tubing here, I'm going to wrap one side of the tape around the tubing just to hold it there as I do my checks. Now, if my patient had any trouble getting and was gagging a lot while I was inserting the tubing, I'm going to go ahead and take my pen light and have him open up, making sure that the tubing isn't coiled in the back of the throat. So then I'm going to go ahead and I'm going to do the checks to make sure that I'm in the stomach. What I'll do first is I'm going to take my cath tip 60 cc syringe. I'm going to draw up 5 to 10 cc's of air, and I'm going to go ahead and unclamp this. And I'm going to insert that 5 to 10 cc's of air as I listen over the fundus of the stomach to listen for a swishing sound. So I'm entering that air. If I hear that swishing sound, I can also draw back 3 to 5 cc's of the gastric contents to check the pH, just to make sure that I'm in the stomach. So I'm going to clamp that off, put my valve back on so that I don't have any leakage. I'm going to go over here, I'm going to put the stomach contents on my pH strips, making sure that the pH is 0 to 4 to make sure that I'm in the stomach. Then I'm going to go ahead, if I know that I'm in the stomach, I'm going to go ahead and grab I'm going to turn my pump on, hook it up to the tubing for the pump. This is going to be my temporary pump for today. So I've hooked it up to the pump, turned my pump on. Then what I'm going to do is I'm going to take a clean cath tip syringe. I'm going to enter another 5 to 10 cc's of air into this blue tubing to make sure that this tubing is not suctioned against the stomach wall. So I'm going to go ahead, if I can get this valve off. Alright, so I've got my valve off. I'm going to enter the 5 to 10 cc's of air to get that tubing away from the stomach wall. And I'm going to re-put the blue to blue anti-reflux valve back on. Then I'm going to take another piece of tape here, and I'm going to put it around the tubing. I'm giving my patient enough flexibility, and I'm going to pin that to his gown so that it's stable. And I will also wrap the other piece of tape around the other side of the tubing so that it is secure on the nose, and then also pinned to the gown. So that is my skill for a nasogastric intubation for this skill.